correct me if I'm wrong, but I think a lot of nurses go into the profession, like it, don't like it, however it goes, but then feel like at one point they get to a bit of a almost like a bit of a dead end where they're not sure where to go
Yeah, get
next,
a
you know?
feeling.
Yeah, it's almost like it's where you either become head nurse and you stay doing what you're doing, and you might move somewhere different and maybe you'll do a certificate, but in theory, your day-to-day role doesn't necessarily change that much. And I know obviously you've now left general practice and have gone on to sort of a way that you can use your nursing role differently. So, I mean, what would you suggest if you were going to speak to other vet nurses that are out there? How do you think they can potentially diversify their careers and why did you do it? Does that make sense?
Yeah, it does make sense. And I think you're right. I think sometimes nurses, certainly when I was in practice, sort of in the early years, it was very much like you got up to head nurse and then that was it. Like you didn't really have, and you didn't get any leadership training either.
Mm.
So you didn't really know what you were doing. I know certainly when I was head nurse, I hadn't done any leadership. You know, there's so much more out there now. Um, but yeah, I think I would always say, like, I still identify as a veterinary nurse. I still feel very strongly that that's part of my identity and who I am. I just do it I still help animals, but in a different way. Um, but yeah, I think people just really, nurses need to go out there and have a look and talk to other people that have done it. Because there's so many different roles. It's not just, I mean, my role's quite educational. I know other people that work as sort of reps for companies that make, I don't know, they do a lot of wound management and dressings, but they're really passionate about wound management and they teach about it as well. Um, Other people that run their own CPD, and run their own kind of events. Lots of people in different leadership skills. Quite a lot of nurses I know have now gone on to do much higher education. There's a few that have done PhDs as well, which
Wow.
just like makes me so happy. Like it
Yeah.
makes me really proud that they've done that. Um, it's just, I think this is why it's good to go to some of these sort of conferences and events, you know, BVNA Congress, London Vet Show, all these kind of things, because you can network and you can talk to people that have done other things and have diversified. I think for me, my story is that I realised cats are very misunderstood. I wanted to help cats. It's like once you see it, you can't unsee it. And I wanted to be able to help others to understand that. And I just kind of, that was my thing. And I know people say, oh, you have to find your niche and have a niche. But I actually would challenge that a little bit. I don't think you have to have a niche. You just need to find something that you enjoy.
Mm.
Then try and pursue that. And it doesn't have to be in clinical practice. There's lots of different ways you can do that.